8 rarest diseases you've never heard of. What if your body slowly turned to bone? What if you woke up one morning speaking in a foreign accent you've never learned? What if your own stomach started brewing alcohol without you ever taking a drink? These sound like science fiction, but they're real medical conditions, and most doctors will go their entire careers without seeing a single one. Today, we're uncovering 8 of the rarest diseases on Earth, conditions so obscure that even medical textbooks barely mention them. Some have fewer than 100 cases in all of recorded history. Others vanished as mysteriously as they appeared. Buckle up, because what you're about to hear will change the way you think about the human body forever. Kuru. Deep in the highlands of Papua New Guinea, an entire tribe was being wiped out by a disease that made its victims laugh uncontrollably right before it killed them. Kuru, which means to tremble in the Fore language, is a fatal prion disease that was once epidemic among the Fore people. Victims first noticed mild joint pain and unsteady walking. Then came the tremors. Then the bizarre, involuntary bursts of laughter that gave the disease its terrifying nickname, the Laughing Death. Within months, patients could no longer walk, eat, or speak. Death was inevitable, usually within a year. The cause eluded scientists for decades until researcher Daniel Carlton Gajusek made a shocking discovery. Kuru was transmitted through ritualistic funerary cannibalism. The Fore people honored their dead by consuming their remains, and in doing so, they ingested misfolded prion proteins that slowly destroyed the brain's cerebellum. When the practice was stopped in the late 1950s, new cases gradually declined. But because prions can incubate for decades, cases continued appearing into the 2000s, more than 40 years later. Gajusek won the Nobel Prize for his work on Kuru, which fundamentally changed our understanding of infectious disease. Kuru proved that a disease could be caused not by a virus or bacteria, but by a protein, a discovery that would later help explain mad cow disease and Creutzfeldt-Jakob disease. Today, Kuru has virtually disappeared, but it remains one of the most chilling examples of how human culture and human biology can collide with devastating consequences. Fatal familial insomnia. What if you could never fall asleep again? Fatal familial insomnia is a rare and incurable prion disease that progressively destroys the brain's ability to sleep. It begins with mild insomnia, but within months, patients lose the ability to sleep entirely. As sleep deprivation worsens, the mind begins to unravel. Patients experience panic attacks, paranoia, hallucinations, and rapid weight loss. Their bodies deteriorate as the brain slowly shuts down. The disease is caused by a misfolded protein, a prion that accumulates in the thalamus, the brain region responsible for regulating sleep. As the prions destroy more and more neurons, the thalamus is essentially eaten away. The condition is inherited through a mutation in the PRNP gene, and it affects fewer than 40 families worldwide. Once symptoms begin, the progression is unstoppable. There are no treatments that can slow it down, and no medications that can force the brain to sleep. Sedatives, sleeping pills, even medically induced comas have all failed. Patients typically survive 12 to 18 months after onset, fully conscious and aware as their minds disintegrate. Fatal familial insomnia is perhaps the cruelest disease on this list, a condition where the body forgets how to do the one thing every living creature needs.
Fibrodysplasia Ossificans Progressiva. What if your body slowly turned to bone? Fibrodysplasia Ossificans Progressiva, known as FOP or Stoneman Syndrome, is one of the rarest and most disabling genetic conditions in existence. The body's repair mechanism is catastrophically broken. Whenever muscles, tendons, or ligaments are damaged, instead of healing normally, they are gradually replaced by solid bone. A bruise, a fall, even a routine injection can trigger a wave of abnormal bone growth that locks joints permanently into place. Over time, a second skeleton forms over the first, encasing the person in a prison of their own bone. The condition is caused by a mutation in the ACVR1 gene, which controls bone growth. This mutation tells the body to form bone where it should never exist. Attempts to surgically remove the extra bone only make things worse. The trauma of surgery triggers even more bone growth. Patients are eventually forced to choose between living in one fixed position or risking movement that could freeze another joint forever. Many become confined to a wheelchair or bedridden by their 20s or 30s. Fewer than 800 confirmed cases exist worldwide. There is currently no cure and no effective treatment. FOP is sometimes called the most terrifying disease you've never heard of, a condition that turns the human body into a living statue, one bone at a time.
Encephalitis Lethargica. Between 1915 and 1926, a mysterious epidemic swept across the world, turning millions of people into living statues. Encephalitis lethargica, known as the sleepy sickness, attacked the brain with devastating precision. Victims would first develop sore throats and fevers. Then, without warning, they would fall into deep catatonic states, eyes open, fully conscious, but completely unable to move or speak. Some slept for weeks. Others remained frozen in bizarre positions for months or even years, trapped inside bodies that no longer obeyed them. The epidemic infected approximately 1 million people worldwide and killed roughly a third of them. Many who survived never fully recovered. They remained in statue-like states for decades, locked in institutions, forgotten by the outside world. In the 1960s, neurologist Oliver Sacks famously administered the experimental drug L-Dopa to a group of these frozen patients. Miraculously, many of them awoke, speaking, moving, and interacting for the first time in 30 or 40 years. But the awakenings were temporary, and most patients eventually relapsed. The cause of encephalitis lethargica has never been definitively identified. Some researchers suspect it was linked to the 1918 influenza pandemic. Others believe it was caused by an autoimmune response. The epidemic vanished as mysteriously as it appeared, and to this day, no one knows what triggered it or whether it could return. Encephalitis lethargica is one of the greatest unsolved mysteries in medical history, a disease that stole decades of life from its victims and left science without answers. Cotard's delusion. What if you woke up one morning completely convinced that you were dead? Not depressed, not suicidal, but genuinely, unshakably certain that you no longer existed. Cotard's delusion, also known as walking corpse syndrome, is an extraordinarily rare neuropsychiatric condition in which patients believe they are dead, do not exist, or are actively rotting from the inside. Some deny the existence of their own organs. Others claim their blood has been drained. A few insist they have lost their soul entirely. The condition was first described in 1880 by French neurologist Jules Cotard, who documented a woman he called Mademoiselle X. She believed she had no brain, no nerves, no stomach, and no internal organs. She was convinced she was eternally damned and therefore could never die of natural causes, so she stopped eating entirely. Modern brain imaging has revealed that Cotard's delusion may involve a disconnection between the brain's face recognition areas and its emotional centers. Patients literally cannot generate the emotional feeling of being alive. The condition is most commonly associated with severe depression, brain injuries, and neurological diseases like dementia.
Treatment typically involves a combination of antidepressants, antipsychotics, and, in extreme cases, electroconvulsive therapy. Walking corpse syndrome challenges the most fundamental aspect of human consciousness, the awareness that we exist. It is a haunting reminder that our sense of self, something we take completely for granted, is nothing more than a fragile neurological construction. Auto-Brewery Syndrome. Imagine getting pulled over by police, failing a breathalyzer test, and being completely sober. That's the reality for people with Auto-Brewery Syndrome, a condition so bizarre that courts have refused to believe it exists. Also known as gut fermentation syndrome, this rare disorder turns the human digestive system into an internal brewery. Colonies of yeast, primarily Candida or Saccharomyces species, overgrow in the intestines and begin fermenting carbohydrates into ethanol. Patients become visibly intoxicated, slurred speech, impaired coordination, confusion, without consuming a single drop of alcohol. Blood alcohol levels have been recorded as high as 0.4%, 5 times the legal driving limit, from eating nothing more than a plate of pasta or a slice of bread. The condition was first documented in Japan in the 1950s, and fewer than 100 cases have been reported in medical literature since then. Many patients go years without a diagnosis because doctors simply do not believe them. Marriages have been destroyed, careers ruined, and custody battles lost because families and employers assumed the patient was a secret alcoholic. Treatment involves strict low-carbohydrate diets and antifungal medications to eliminate the yeast overgrowth, but relapses are common. Auto-Brewery Syndrome is a medical condition that sounds like a joke until it destroys someone's life. It is living proof that the human body is capable of things that even doctors struggle to accept.
Foreign accent syndrome. In 2013, a woman from Texas suffered a severe jaw injury and woke up speaking with a perfect British accent. She had never been to England. In 1941, a Norwegian woman was hit by shrapnel during a bombing raid, and after recovering, she spoke with a strong German accent in the middle of Nazi-occupied Norway. These are real cases of foreign accent syndrome, one of the rarest neurological conditions in existence. Fewer than 100 cases have been documented since it was first identified in 1907. The condition occurs when specific areas of the brain responsible for speech planning and motor control are damaged, typically by stroke, traumatic brain injury, or, in rare cases, multiple sclerosis. The damage subtly alters how patients control their tongue, lips, and vocal cords, changing the rhythm, pitch, and pronunciation of their speech in ways that listeners interpret as a foreign accent. Patients are not actually speaking another language or imitating an accent. Their brains have simply lost the fine motor programming for their native speech patterns. The psychological impact is devastating. Patients report feeling like strangers in their own bodies. Friends and family cannot recognize their voices. Some are accused of faking the condition for attention. Recovery is possible through intensive speech therapy, but many patients never fully regain their original accent. Foreign accent syndrome is a small, precise neurological glitch, but it strips away something deeply personal, the sound of who you are.
Field's disease. We've saved the rarest for last. Field's disease is widely considered the rarest diagnosed disease in the world because it has only ever been found in 2 people. Catherine and Kirsty Fields are twin sisters from Wales who began experiencing progressive muscle deterioration as young girls. Their muscles slowly weakened and wasted away,
causing increasing difficulty with movement, speech, and daily activities. Despite extensive testing at some of the world's leading medical centers, no existing diagnosis fit their condition. Doctors could not match it to any known neuromuscular disorder. Eventually, the condition was simply named after them, Field's disease, because there was no other name to give it. The sisters' motor neurons are gradually degenerating, but the pattern and cause do not match any established disease. Because only 2 cases exist, there is virtually no research base. There are no clinical trials, no experimental drugs, no treatment protocols. The sisters rely on painkillers and medications to manage symptoms, but there is no cure and no way to predict how the disease will progress. Field's disease represents the outermost edge of medical knowledge, a reminder that despite all our advances in genetics and neuroscience, the human body can still produce conditions that are completely unique, completely unexplained, and completely beyond our ability to treat. When only 2 people in the entire world share your diagnosis, you are not just rare, you are medically alone.
From a body that turns to bone to a disease so rare it only exists in 2 people, these 8 conditions reveal the most extreme and hidden corners of human biology. Most of them will never appear in textbooks. Many doctors will retire without ever encountering a single one. And yet, behind every case is a real person living with something the rest of the world can barely comprehend. If this video changes one thing, let it be this: never take your health for granted. The human body is extraordinary, but it is also fragile in ways we are only beginning to understand. If you learned something today, share this video with someone who needs to see it. And remember, the rarest diseases often teach us the most about what it means to be human.